In addition to all of the things I've said already, I want to talk to people about eyeglasses. People currently believe that eyeglasses can correct your vision. They believe that if you wear your glasses, your eyes will get better, and if you don't wear them, your eyes will get worse. This is not true. Let me repeat, this is not true. Whether or not you need glasses is a physical problem. The size of the eye and the shape of the cornea. If your eye grows too long, the focus of light is within the eye, and you'll get a blurry picture on the retina. The treatment is a concave lens, which will cause the focus of the light inside your eyes back to the retina. This is a carefully measured amount. Conversely, if the eye is too short and the eye needs something to lengthen, so they use a convex lens to lengthen the focus of the lens inside the eye. And third, the word astigmatism, which seems to be a magic word to everybody, and it means very little. Astigmatism is the shape of the cornea itself, sometimes the shape of the inside of the eye, but mostly astigmatism is corneal. If your cornea is not perfectly round like a basketball, or takes on a more football appearance, you have astigmatism. The further away your eye is from perfect sphere, the more astigmatism you have. It doesn't matter how big your eye is, how small your eye is, or the shape of the cornea. Wearing glasses will correct that visually. The glasses or contact lenses, if you wear them, will move the image to the back of the eye, the same like a pair of glasses will, and cause you to see everything clearly, and that's all it would do. So that whether you see clearly or not at any one given time depends on the measurement of your eye or the genetic process which controls the growth of your eye itself. So wearing glasses or not wearing glasses, contact lenses, and even LASIK surgery will not change the shape of your eye as you age. So that do not concern yourself with that your eyes are getting worse because you're getting more nearsighted or more foresighted or have astigmatism. They can always, in the absence of eye disease, they can always be corrected 100%, providing that the health of your eye is maintained. So let's go back to the beginning. You reach the age of 60 and you want to take care of your eye. These are the things you should do. These are the things and to look for in an examination. First, who should you go to for this examination? Well, you should go to a private ophthalmologist or a private optometrist. I would not recommend these chain places because they are mostly just interested in selling glasses, and although some of them may provide an adequate examination, some of them may not. They may only be interested in the speed so they can get to the next person. At a reputable ophthalmologist or optometrist, this is what you should expect from the exam. First of all, he should ask you your ocular history. Do you wear glasses? When was your last exam? Do you have certain diseases, diabetes, high blood pressure, things like that? Renal disease can also cause problems. Kidney disease can also cause problems inside the eye. Nothing to do with eyeglasses, but diseases that can badly injure your vision. You should have the doctor check the pupillary reaction, whether your pupils are reactive properly to light or not properly to light. They should also include a peripheral vision examination to make sure that most of your retina or all of your retina is intact and seeing. They should also include a pressure test, what they call an intraocular pressure of your eye, to determine the actual pressure of your eye, because excessive pressure in the eye could be glaucoma. If it is glaucoma, then that will require a visual field test to show if there is any damages that this excessive pressure in your eye is. Now, if you've been to an eye doctor, you might have been to where they shot a puff of air into your eye, or they approached your eye with a blue light, put some medication in your eye, some dye and some anesthetic so you don't feel the device, and that will show the measure of pressure in your eye. Very accurately, as a matter of fact. And if it is high, and anything over 20 is considered elevated, over 22 is considered high, and over 24 or 25, pressure should be carefully examined to make sure that this is actually glaucoma. All right? If it is, there is treatment for glaucoma. In the United States, the first treatment is usually a medical one, where they will prescribe drops for your eye of chemicals that will lower the pressure of your eye. Once that is done and your eye is down to a normal pressure, the damage from high pressure inside the eye can be controlled. Now, why would the pressure inside your eye get high? Well, two main reasons. Number one, you may be producing nutrients, fluids, faster than the eye can relieve them. Second, the actual outsourcing of this increased fluid in your eye, that area called it's a canal called canal of Schlemm, could be clogged or blocked by pigment, by many other things, so that the fluid cannot get out of your eye as quickly as it gets into your eye, thus increasing the pressure inside your eye, and in so doing destroy the optic radiations and eventually the optic nerve and eventually the eye itself. When the pressure gets very high, it's painful, but until it does that, there is no knowledge of anything going wrong. There are no symptoms to early glaucoma. None. Zero. That's why you must have a glaucoma test every time you go to the eye doctor. That is essential. You make sure that your eye doctor is doing such a test, and you should ask him about it. And keep a record of the pressure of your eye so that you have it. Let's say you come at age 65 and the pressure is 19. Then you come again at 66 and the pressure is 20. And in 3 years, if it's continually rising, then you should really demand a more thorough eye test for glaucoma, which would include visual fields, testing the activity and the nerve fibers in the retina themselves. If these are all damaged because of the pressure, immediate medication should be prescribed. If the pressure is rising a little too fast, medication should be prescribed. Now, there are many things that may cause high pressure besides glaucoma, such as if your cornea is too thick, a mint of other things. The progression of the disease and the treatment of the disease are the most important things that happen. If your pressure in your eye is progressing too rapidly or too high, it should definitely be treated. I want to once again go back and say you should not neglect your eye. You must. If you're over 65, over 60, you must see an eye doctor once a year minimum. You're at risk, regardless of whether you need glasses or not. Needing or not needing glasses is no indication of the health of the eye itself.